We all struggle with feeling like there's not enough time in the day to be productive personally or professionally. We all struggle to make our time matter. It's time to take control. It's time to start investing in the corporation of you. At Athena, they've helped over 700 ambitious professionals achieve more by connecting them with best-in-class, globally remote executive assistants. Athena executive assistants go beyond basic administration tasks. They help you make time matter through the art of delegation. They believe delegation is the superpower of all highly successful people, and your personal EA will help you get there. Your EA is a one-on-one long-term partner to help you achieve your personal and professional goals. Take back your time. Join the waitlist at athenago.com. That's athenago.com.
We all know about the pandemic that has come to define 2020. Understandably, COVID-19 has dominated the world's agenda, and mandatory lockdowns were introduced in many countries to help control the spread of the virus. For many of us, the lockdown was inconvenient. We couldn't go to our normal places of business, we couldn't visit family or friends, and we couldn't socialize publicly. But for some people, the freedom to get out of the house was not just a matter of convenience, but of physical safety and even life or death.
More than 10 million people in the U.S. are abused by their partners each year. 1 in 4 women and 1 in 9 men are assaulted by an intimate partner during their lifetime. And then came 2020. The U.S. was simultaneously met with the COVID-19 pandemic, economic shock, and civil unrest. The intensity and uncertainty of these conditions created a perfect storm for an increase in domestic violence reports nationwide. Not only did record unemployment, a year-long lockdown, and nationwide social injustice exacerbate existing abusive behaviors, but these same factors also decreased access to help for survivors. 2020 quickly became a catastrophe for many, including domestic abuse survivors. October is Domestic Violence Awareness Month, and in this special episode of The Heart of Healthcare, we will be looking at the rise in domestic violence and how we can help stop it. Domestic violence, or what some call intimate partner violence, IPV, has significant public health and financial consequences, including injury, chronic pain, GI and gynecological disorders, STIs, depression, and PTSD. It is also associated with billions in healthcare costs and lost work productivity annually. The incidence and prevalence of domestic violence is notoriously difficult to measure because cases are underreported. Historically, researchers have looked at data from law enforcement agencies, emergency rooms, domestic violence hotlines, social service agencies, as well as some self-reported victimization surveys. While we don't know the exact number of victims, we do know the key risk factors that could lead to domestic violence. And unfortunately, a lot of these risk factors were amplified during COVID. The first risk factor is low income and economic stress. Research shows that domestic violence rates are highest in the poorest neighborhoods where victims have less access to social and private services.
Pandemic-related unemployment will reverberate in many different ways throughout the country for months, quite possibly years to come.
The sudden loss of a job, coupled with prolonged proximity to partners during a nationwide shelter-in-place mandate, made for a ticking time bomb for many households. Roughly 6.2 million workers lost access to employer-based health insurance during this time period. And since ACA-compliant plans must cover essential health benefits, this meant 6.2 million Americans lost free access to preventive and mental health services, including domestic and interpersonal violence screening and counseling. In February of 2020, 6.2 million Americans were unemployed. But by May, the unemployment numbers surged 230% to 20.5 million Americans. Young workers, immigrants, Hispanic Americans, Black Americans, and those without a college degree were disproportionately affected. Even after controlling for other factors at the relationship, individual, family, and community levels, economic shock and the multiple associated impacts increase the risk of victimization and perpetration. Loss of health insurance, loss of income to safely leave a violent situation, and the health impact of increased stress and depression, just to name a few. Sudden macroeconomic downturns create uncertainty and anticipatory anxiety, which can lead to abusive behaviors. The second leading factor of domestic violence is alcohol abuse.
In the recovery world, there's this old saying, the opposite of addiction is connection. And when we distance ourselves, to stay safe from COVID, we're losing that connection to folks. And oftentimes, people turn in that isolation to alcohol.
From March 1st to April 18th, 2020, alcohol was the fastest growing e-commerce category among consumer packaged goods. In April 2020, alcohol sales online were 6 times higher than the same period in 2019. We know that alcohol use increases the chance and severity of domestic violence. Alcohol use directly affects cognitive and physical function. It reduces self-control, and it leaves individuals less capable of negotiating a nonviolent resolution to conflicts within relationships. As such, alcohol is widely considered to be a key proximal predictor of family violence. The next contributors are stress and anxiety.
People are not necessarily achieving or getting into treatment, and it's been hard for them to get to treatment. Added stresses of loss, grief, worry about finances. And again, then the services that they relied on are not necessarily available to them.
A May 2020 poll by the American Psychological Association showed Americans experience considerable stress related to COVID-19. The average reported stress level for U.S. adults related to the pandemic was 5.9, up from 4.9 in 2019. The stress level for parents with children under 18 was 6.7, and nearly half of parents reported a high stress level between 8 and 10 on a 10-point scale, where 10 means a great deal of stress. Natural disasters and crises are known to provoke immense stress responses that correlate with increases in domestic violence. Stress and anxiety can trigger anger, mood swings, and irritability. This occurs when exposure to acute stress alters hormones, including testosterone and cortisol. A combination of high testosterone levels and low cortisol levels has been linked to increased dominant and aggressive behaviors. The provocation of stress may even increase proneness to violence by altering their hormones. Increased gun sales also played a part in increasing domestic violence.
Since the pandemic began, gun violence has spiked across the U.S. In D.C. alone, there have been more than 900 shootings since last March. More than 260 people have been killed.
This is happening across a lot of cities, urban cities in the United States as a whole. And some of the factors that really contribute to what we're seeing are the social and economic instability and inequality that we've seen consistently, but also particularly as a result of COVID.
One study estimated a 2.1 million excess in gun purchases from March through May 2020. That's a 64.3% increase over the expected volume. The Brookings Institute estimated that almost 3 million more guns were sold from March to July 2020 than would have ordinarily been sold during those months. Guns in the home are associated with an increased risk of homicide by a family member or acquaintance. In fact, the presence of guns in the home is associated with a 5-fold increase in homicide risk within the home. And in homes with previous domestic violence incidents, the chances of homicide are 20 times as high. The last factor, and the one that most likely affected all of us, is isolation. The stay-at-home, save lives mantra meant that in order to protect the public from COVID-19 infection, the entire country had to remain in their homes. By April 20th, at least 316 million people in the US were urged or mandated by government officials to stay home. Isolation plays a major role in domestic violence. It's used as a tool to control a victim's activities and interactions with the outside world. Isolation is one of the 8 tactics on the power and control wheel of how abusive partners gain control within their relationships. Isolation is considered a risk factor for domestic violence, whereas on the other side, social support is considered protective for victimization. Many state and local officials failed to clearly communicate available protections for survivors during the lockdown. According to the Center for American Progress, of stay-at-home orders issued between March 12th and May 12th of 2020, only 17 states explicitly listed domestic violence survivors as people exempt from stay-at-home orders. The federal guidance failed to clearly indicate that essential businesses include domestic violence resources such as shelters and other programs. And only 5 states, Colorado, Minnesota, North Carolina, Illinois, and Indiana, explicitly listed domestic violence shelters as essential in state guidance. Doing so both clarified protections available to survivors and communicated that state and local officials recognize survivors' ongoing needs during the pandemic. During the stay-at-home lockdown, it became harder for domestic violence survivors to seek help. Constant surveillance made it harder for victims to call for help. The combination of more time at home and less work made it easier for perpetrators to strip their victims of freedom and privacy and prevented survivors from help seeking. Fear of exposure was also used by abusers as a tool to keep victims isolated at home and away from social contact. This was especially problematic because social networks and in-person interaction is paramount to identifying and ultimately helping survivors of domestic abuse. This includes informal networks like coworkers, friends, family members, neighbors, and then the formal networks, nurses, doctors, teachers, police officers, social workers. The closing of most schools in the US in 2020 made it more difficult for teachers and school counselors to screen children for abuse. State child protective services agencies receive millions of referrals each year, with educational personnel serving as the largest percentage of reporters at a little over 20%. Even for schools that move to a virtual classroom, advocates say children are less likely to confide in teachers virtually, especially if the child has no privacy at home. Healthcare providers are also often the first line of response for a survivor. In fact, the USPSTF recommends that clinicians screen and provide counseling on domestic violence in all women of reproductive age. But access to healthcare providers was hampered during the 2020 lockdown as health systems canceled non-essential appointments and procedures to focus on the COVID-19 pandemic. We'll be right back after the break.
Has your chronic illness made it difficult to continue working in the traditional way? Want to learn how to find and create flexible remote work that both accommodates your chronic illness and generates an income? Join the Patients Getting Paid membership, a community of chronicpreneurs where people just like you find workshops and trainings, weekly updated condition-specific gigs, twice monthly coaching calls, co-workings, accountability, and the kindest community to support you on your path to make money while working from anywhere and taking good care of yourself. Learn more or join us at patientsgettingpaid.com.
The unemployment crisis continues to affect people all across the country due to the coronavirus pandemic. And now, according to data, women are facing more job losses than men, specifically women who are non-white.
Financial inequality has oppressed women for centuries and is the reason women today earn just 81% of the salary men earn for the same exact job. Financial inequality has shaped the dynamics within marriages and diminished women's autonomy. It also makes it more likely a woman is financially dependent on her spouse especially if she has taken time off to have children. Evidence suggests economic dependence significantly influences women to remain with an abusive partner. The economic shock that occurred in 2020 made it even more difficult for survivors of domestic abuse to leave.
Women have been disproportionately impacted by the job losses this time around. So more than 60% of job losses have been by women. And it's mainly due to the fact that women are more likely to be in sectors that have been hardest hit. So the service sector, leisure and hospitality, education, childcare, those sectors have been hardest hit during the pandemic.
Systemic racism and the ensuing civil unrest in 2020 made it especially difficult for Black, Hispanic, and Indigenous people to seek support from the criminal justice system.
Black Americans have been disproportionately dying from the pandemic, which has revealed a lot of the systemic inequities that exist in our society, particularly in our health system, and their impact on Black communities. We've also seen, mass shutdowns of people in their homes. They're feeling socially isolated. They're feeling powerless. They're feeling restless, anxious. And so there's been tremendous kind of pent up energy across American society for several months.
Historic police racism and violence negatively influence the willingness of a BIPOC domestic abuse survivor to call police or cooperate with the criminal justice system in prosecuting a partner. For some, calling the police to report a domestic violence dispute may be the riskiest option, as it may incite more violence from the perpetrator, result in economic insecurity or homelessness after the perpetrator's arrest, lead to the separation of children, or simply put their life at risk. In fact, someone experiencing domestic violence is 2 to 3 times more likely to experience abuse or a neglectful response from law enforcement. And Black women in particular are more likely to be arrested by the police just for reporting domestic violence. Furthermore, non-white mothers are more likely to be referred to Child Protective Services for domestic violence-related concerns relative to white mothers, who are more likely to be referred for mental health services. Zoe Flowers, a domestic violence advocate, said, "Stories of police brutality, the over-incarceration of Black men, coupled with historical and present-day oppression, makes many Black women survivors reluctant to turn partners over to a criminal justice system." The distrust of police, especially among Black women, hit a boiling point in 2020. While police brutality of Black women is not a new issue, the rise of the Say Her Name hashtag movement, sparked in part by the death of Breonna Taylor, created a more widespread conversation of the issue. At the same time, the Black Lives Matter social justice movement broadened the conversation of the ways in which Black Americans are affected by violence, police misconduct, and injustice.
We've been losing people consistently year after year after year, regardless of all of the protesting that we've done and the strides that we've made to move in the right direction. It's a tough space to operate in when you are constantly dealing with grief and sorrow and death.
So what can we do about the rise of domestic violence? First and foremost, we must address isolation and create protective environments for survivors of domestic violence. Perhaps the most dramatic change of 2020 was forced isolation. Not only did this give more exposure to abusers, but it also reduced access to formal and informal support networks, making it more difficult for survivors to seek help. The vast majority of survivors disclose abuse to at least one informal support person, with family and friends being among the most utilized and generally considered the most helpful and supportive. This is especially true for survivors of marginalized backgrounds due to the disparate and racist treatment they may receive from formal sources of support, such as the criminal justice system or social service agencies. While teachers and healthcare providers offer an important first-line response in many cases, a study published in the Journal of Family Violence found that in states where formal networks are mandatory reporters, meaning required by law to report anything they learn of, it often reduces the survivor's ability to receive the support they seek and may make the situation worse for survivors. Survivors' satisfaction with their informal support network has been shown to be a predictor of self-esteem, emotional health, level of loneliness, and quality of life. Activating this informal network in this unprecedented time of stress and isolation could be a more pragmatic approach. Second, we must restrict people with a history of violence against women from owning any type of firearm. The Brookings Institute estimated that almost 3 million more guns were sold from March to July 2020 than would have ordinarily been sold during those months. There's no way to know exactly how many of these guns were sold to purchasers with a history of violence against women. There are federal laws that ban those convicted of domestic violence from purchasing a gun, but they're problematic loopholes that have not been universally addressed. Federal law only bans abusers who are married to the victim, have a child with the victim, or live with the victim. This is what we call the boyfriend loophole, because many boyfriends or flings who've been convicted of domestic violence can still buy or own a gun. Federal law does not prohibit the purchase or possession of a gun by those subject to temporary domestic violence restraining orders, even though the most dangerous time for a victim of domestic violence is when they leave their abuser. Finally, federal law requires background checks for gun purchases from licensed arm dealers, but not from private sellers. This is called the private transfer loophole that allows known abusers to circumvent the gun ownership ban simply by buying from private sellers. Since we know access to guns by known domestic violence abusers increases the risk of intimate partner murder 20-fold compared with unarmed abusers, policies restricting access to guns by domestic abusers can reduce the prevalence of domestic violence. Next, it's important to note that survivor support must be fully accessible to all survivors. Survivors represent all gender identities and sexual orientations. LGBTQ people face disproportionately high rates of intimate partner violence, so it's critical to ensure that programs and support services are free from discrimination. According to the American Center for Progress, transgender survivors are regularly denied homeless shelter services based on their gender identity or transgender status. Let me conclude this special episode by saying we need to use this time as an opportunity to work with experts and community members most impacted by domestic violence. We must hold our state and federal governments accountable for providing resources and advocate for prevention and response services. If you're looking for ways to help, it's important that we support the nonprofits on the ground helping survivors of domestic abuse. Since most of these nonprofits serve local communities, ask around in your area for which shelters and survivor support groups could use your help. Thank you for tuning in to this special episode of The Heart of Healthcare.
Thank you for listening to the Heart of Healthcare podcast. If you liked today's show, be sure to subscribe, leave a review, follow us on social, and tell all your friends to listen. The Heart of Healthcare with Hallie Tecco is a product of OffScrip Media. Our executive producers are Holly Tecco and Matthew Zachary. Our senior producers are Brianna Seeley and Andrew McDowell. It is mixed and edited by Brianna Seeley. For advertising and media inquiries, email media@offscrip.com. Hit us up at contact@offscrip.com to share comments, feedback, and make recommendations. For more information, visit offscrip.com. That's offscrip, no T.com.